Hello students, welcome to this session. This session is basically to orient you regarding pathology. We will be talking little bit about the history as well as how to approach the subject. In detail, how to read, how to make notes and how to do well in your MBBS as well as NEET entrance. Okay, so we will start our session. First, we will know little bit about microscope. The first microscope was invented in the year 1590 and two father-son duo who were spectacle makers, that is Hans and Zacharias Janssen, they were the person credited to have invented the first microscope. Okay? Now the same microscope was put into biological use by these famous personality. Okay, can you identify this personality? Yes, let's take a guess, because this you may get as a quiz question. You may be shown this picture and you may be asked, who is this famous personality? Okay, so have you guessed? Yes, you are right. He is Antony von Leeuwenhoek. Okay, he lived from 1632 to 1723. He also made his own microscope in the year 1688, and this was the first microscope made by Leeuwenhoek. Okay, and he is credited to have discovered bacteria as well as protozoa. Okay, he was the first person to see red cells, spermatozoa as well as crystals under the microscope. Okay, so that was about microscope. Now we move on to pathology. Okay, the history of pathology. If you see here, I have mentioned four terms. First is Virchow triad, second is Virchow space, third is Virchow cells, and the fourth is Virchow nodes. Now if you see, all these four terms have one thing in common, that is Virchow. Okay, now who is this Virchow who has been credited with so many things in pathology? Okay, again you have to remember this picture, because he is the person who is responsible for lot of developments in pathology, and he is credited as the father of modern pathology. Okay, so he is Rudolf Virchow, who lived from 1821 to 1902, and he is known as the father of modern pathology. Okay, he was a German physician and he was the first person to say the cellular basis of disease. I mean that the disease starts at cellular level. Okay, he was also the first person who described or who introduced systematic method of autopsy. Okay, autopsy means post-mortem. Now autopsy can be medico-legal autopsy, which we do for medico-legal purposes like road traffic accidents or death due to unnatural cause, whereas here you can see another cause is a medical autopsy. Okay, one is a medico-legal autopsy, which is for legal purpose, whereas other is just a medical autopsy to know the cause of death. Okay, the cause of death or what the person was suffering from. So he was the first person who introduced systemic method of autopsy. Okay, next he coined many terms, or you can say many of the terminologies are started by him, like chromatin, neuroglia, parenchyma. This is in brief, I have mentioned 2-3. There are numerous terms that this famous personality has coined. Okay, now what is Virchow's triad? Now Virchow's triad you will be reading more in the hemodynamic chapter when we will be discussing about thrombosis. Okay, that is about Virchow's triad, this Virchow-Robin space. Okay, so what is Virchow-Robin space? This is a space around the blood vessels. Okay, so this is the blood vessel. The space around the blood vessel in the brain or central nervous system is called as Virchow space. Okay, now what is Virchow cells and what is Virchow nodes? These things also we will be discussing in our subsequent sessions when we are discussing details of pathology. Now here comes another personality, famous one. You have to remember this image. He is again, you can say, one of the pioneers in the field of pathology and specifically cytopathology. Okay, he is the person who is credited to have started cytopathology. Okay, so he is, yes, can you guess? He is George Papanicolaou. Okay, he lived from 1883 to 1962. Okay, in 1920 he began his work in human reproductive system. So what he used to do, he used to take some vaginal smears, okay, vaginal smears, then he used to stain them and then he used to see how the cells look like, okay, cells look like, and that is how he started early cancer detection, okay, in the cervical cancer. If you know that any cancer can have two stages, one is pre-invasive or early stage and one is invasive. Okay, so invasive is the late stage whereas pre-invasive is the early stage. So he is the person who is credited to have done this early stage detection of cervical cancer. Okay, and cervical cancer, if you know, is one of the most common disease in Indian females. Okay, along with carcinoma breast, carcinoma cervix is one of the common disease, and if you see, he is the person who first started screening. Okay, so screening means early detection, and early detection means early cure, and early cure means it is good for the patient. So he began his work in 1920, and this is the smear, you can see the pap smear, and this is how the name came, pap smear. And this is a screening test which we will be discussing in our sessions in cytology as well as our discussions on female genital tract. So you have to remember this pap smear comes from the term as well as the pap stain. Okay, pap smear as well as the pap stain, which is a short form of Papanicolaou stain. So this staining comes from the name that is Papanicolaou. Okay, so he was the pioneer of, or you can say the father of modern cytology. Okay, he was the person who first stained and studied female genital tract pathology. In 1943, he published his work on diagnosis of uterine cancer by the vaginal smear examination. So we have seen history, that is Rudolf Virchow and Papanicolaou, but there are numerous other physicians or pathologists as well as microbiologists who have contributed to development of the subject, but these two are the most important ones. Okay, so after a little bit of history, now we move on to our subject, that is pathology. So what is pathology about? Pathology is a Greek word which consists of two words, pathos and logi. Pathos means it is disease, okay, or suffering, and logi means it is the study. So the study of diseases is called as pathology, and the person who studies this process is called as a pathologist. Okay, so this is the term pathologist, a person who studies the cause, why it happened, and the effect, what will be the outcome of diseases from different body samples. Okay, now body samples can be anything. It can be a cytology sample, okay, like I told you, your cervical cancer screening, okay, so pap smear, so that is a cytology sample, or it can be a hematology sample. Okay, so hematology, suppose somebody is suffering from anemia, somebody is suffering from leukemia, somebody is suffering from thrombocytopenia. So these are some of the common diseases that a pathologist can diagnose from blood samples. Okay, then we have the third common sample, that is biopsy, or it is a tissue sample. So a small bit of tissue is taken out from the pathological area and it is processed. Okay, so it is processed, then it is stained, and then the pathologist sees under the microscope and says what is the disease we are looking at, okay, or what kind of abnormality the patient is having. If you can recall or if you can remember that most of the work of pathologist is microscopic. So microscopic is our main weapon and we use this microscope to diagnose, or you can say we screen, we diagnose as well as we prognosticate. So what does screening mean? I have already told you about pap smear. Okay, pap smear is a screening program or is a screening method, whereas diagnosis is, suppose a biopsy is taken and the pathologist has to say whether it is neoplastic, whether it is non-neoplastic, and if it is non-neoplastic, whether it is inflammatory, whether it is infective. So all this depends on diagnosis, and once the diagnosis is made, the specific therapy can be given. Like say for example, if tuberculosis is diagnosed, then ATT can be given, whereas if a lymphoma is diagnosed in a lymph node, then chemotherapy can be given. Okay, that is how the treatment absolutely depends on what report the pathologist reports or the pathology diagnosis. Then prognosis. Now what is prognosis? Suppose for example, let's take two females, one is A, the other is B. Okay, a female A is diagnosed at an early stage, or you can say is diagnosed as an early stage of cancer, whereas female B is diagnosed as a late stage of cancer. So who do you think will do better? The A person will do better as compared to B, because it is diagnosed at an early stage. And who does the diagnosis? It is the pathologist who diagnoses the problem. Okay, second thing, like prognosis, you can say two breast carcinoma, for example A breast carcinoma and B breast carcinoma. Okay, now A is HER2 positive, Herceptin positive, where you will be knowing about the detail of this in the breast chapter, and B is Herceptin negative. Okay, so this is triple negative and this is Herceptin positive. So we decide, the pathologist, that if a tumor is Herceptin positive, then the patient will be treated with Herceptin, but if HER2 nu is negative, then Herceptin drug will not work on these patients. So that is about prognosis. Again, I will stress the screening, the diagnosis as well as prognosis is done by the pathologist. Now every subject evolves, or everything has an evolution. Everything evolves over a period of time. So how pathology has evolved over a period of time from Rudolf Virchow to Leeuwenhoek to, you can say, our Papanicolaou, and now at present. So if you talk about processing, the way we process our tissues or body samples has evolved from manual method to semi-automatic to now we have fully automated tissue stainers. Okay, we have tissue processors as well as stainers. Okay, so now we don't do it manually with our hand, we have mechanized, or there are machines which do all this work for us. Okay, the next point is observation and interpretation. When they started, if you see the microscope which I showed you, that was a very primitive microscope that Antony von Leeuwenhoek used, but if you can remember, say 30 years back, all our professors or all our ancestor pathologists would have used a monocular microscope, okay, where the light source is different. Then comes binocular microscope with self illumination. Okay, so light source was there in the inbuilt in the microscope, and now at present we have slide scanners. So if you talk about slide scanners, the pathologist does not even need to look at the slide. Okay, so pathologists need not look at the slide. So there is a machine called a slide scanner. It will look at the slide, it will take images, live images. Okay, so it will be recording the images. The images can be seen in any monitor, or you can say in any computer by the pathologist. So you can imagine how much change is there from monocular microscope to slide scanners, where the pathologist does not even have to look at the microscope, everything is displayed on the screen. The third comes your diagnosis and categorization of pathological process. Okay, initially say 20 years back it was only about the morphology, how the tumor looked, how the pathology or inflammation looked. Okay, so with experience people used to say this is a lymphoma, this is a carcinoma, this is a melanoma. But morphology is not always correct, because some tumors have varied morphology and one tumor can mimic the other. Okay, so in order to bypass that, then came special stains IHC and DIF. Okay, so IHC means immunohistochemistry. Okay, so in immunohistochemistry, suppose we are suspecting that the patient is having a carcinoma, we do a CK stain. If we are suspecting a lymphoma, we will do a LCA stain. If we are suspecting a melanoma, or in order to confirm a melanoma, we can do HMB45 stain. Okay, so that is how the things have evolved. Previously a professor would say that this is melanoma and the report would go as melanoma. Today the clinician will ask us, sir, are you convinced with melanoma, or it could be something else, and we have to prove it with the help of these immunohistochemical markers. Okay, and when we talk about DIF, that is immunofluorescence. Okay, so this is direct immunofluorescence, and its use is in kidney biopsy as well as in skin biopsy. Now for example, if somebody has a vesiculobullous disorder, okay, so this is vesiculobullous disorder, then to know the exact etiology of this vesiculobullous disorder, we need the help of DIF for confirmation. Now talking about special stains, we have some special stains like ZN stain, that is Ziehl-Neelsen stain for tuberculosis. Now if we are suspecting leprosy, then we can do a Pfeiffer's stain. Okay, there are numerous stains, I have just mentioned some common ones. Okay, so how the diagnosis and categorization has evolved. Categorization means if there is a neoplasm, whether it is a carcinoma, it is a melanoma, or it is a lymphoma. That is what we mean by categorization. Okay, the next point is molecular. Now I told you IHC is second. Suppose a patient has a breast carcinoma, okay, and we have done HER2/neu. Now HER2 is say doubtful, it is neither positive or it is negative, it is doubtful. In those cases we have to do a fluorescence in situ hybridization. Fluorescence in situ, okay, and H means hybridization. So we have to do this method to confirm that whether HER2/neu is truly positive or truly negative, and if it is truly positive, then the patient can be given Herceptin therapy. Okay, so that was about molecular methods, and now we are going into sequencing, or it is called as next generation sequencing. Okay, so we can find out what was the abnormality which lead to this pathological process, and all those abnormalities can be detected at genetic levels. Okay, so now has come sequencing. So you can see how the subject has evolved. Now the subject has evolved, or you can say the subject is evolving, and say from 20 years back when the subject was only pathology, today it has got many sub branches. Okay, so there has been branching for pathology. So when somebody did MBBS say 30 years back and would do one MD, then it is called as specialized. Okay, today it is not only about MD or pathology, people study only hematology. Okay, and this is a branch that deals with blood related disorders. Okay, so people are specializing in hematology will be looking only after blood related disorders. When we talk about histopathology, this deals with biopsy. Okay, this is a very important branch of pathology where we do a biopsy, and this biopsy is done for diagnosis, confirmation as well as categorization. Okay, so categorization means whether it is a lymphoma, melanoma, sarcoma, what is the tumor, how it will respond, the diagnosis as well as the prognosis. We say it is a low grade, it is a high grade, so all those things will be reported from pathology. And today we have people who are called as histopathologists, and they look only after biopsies, they do not look after other sub branches of pathology. When we talk about another anatomic pathology branch, that is autopsy or forensic pathology. This branch again deals with biopsy or tissue, but here one more clinical aspect is involved, that is autopsy. In histopathology, the tissue is sent to us, but in autopsy, we perform the postmortem and take different representative samples. Okay, so take different representative samples and we examine and we say what is the pathological process because of which the patient has died. Or you can say histopathology is a live pathology, whereas autopsy or forensic pathology is dead pathology. Okay, so once the person is dead, we even can study on the dead tissues and we can find out what is the pathological process because of which this person has died. Next comes cytopathology. Now cytopathology deals with the study of cells. And what are the branches? Again in cytopathology, you can have FNSC, which is fine needle aspiration cytology. Okay, so this is one branch. You can have pap smears, which is for cervical smear. You can have body fluids also. So this is one branch where the pathologist looks only after the cells, so it is called as cytopathology. The next is clinical pathology. Now what is the thing that a clinical pathologist does? They look after urine and semen. Okay, as well as blood samples. These are two of the common samples. Also you can include stool. So these are some samples that a clinical pathologist specializes with. Okay, the next comes immunopathology. Immuno means it is related to immunity. Okay, like autoimmune disorders. Can you name any autoimmune disorder? Very common one, young female, yes, very good, SLE, okay. So SLE is a common autoimmune disorder seen in young patients and so many antibodies are there in SLE, okay. We will be reading through them and that is antibodies, and these antibodies, to pick up these antibodies, the subject is called as immunopathology. As well as immunopathology, they deal with immunodeficiency disorders, okay. Now immunodeficiency disorders like HIV, you can have primary immunodeficiency like you can say common severe combined immunodeficiency, okay. This is just one of them. So these immunopathology subjects deal with immunodeficiency disorders, autoimmune disorders as well as transplant disorders, okay. That is about immunopathology. Next comes the molecular pathology. So here we have morphology in histo, cyto, hemat, clinical, where we see all morphology under the microscope, whereas in molecular pathology we study the abnormality at genetic levels, okay, genetic levels or mRNA by DNA level. So the abnormality is studied at this level, and now all these branches whatever I have spoken about are actually subspecialties. Okay, so now a person after doing MD pathology can specialize in any of these branches to have better diagnostic capabilities and to provide better service. Okay, after knowing the sub branches or subspecialties in pathology, we move on to why pathology is important or why we need to know this subject. The first point is pathology is considered as the mother of all subjects. Now most of you will agree with this statement, but some of you may differ with that, but I agree that pathology is the mother of all subjects. And why do we say this? Because if you read any book or any disease, okay, if you read any book and any disease, every disease will have a section under it called as pathogenesis. You name this disease, whether it is neoplastic, whether it is non-neoplastic, or whether it is a infective etiology, every disease will have a pathogenesis. So that is why it is called as mother of all subjects. You may put it this way, that we take the clinical departments as the leaves. This is the clinical department, okay, like medicine, surgery. You can put here medicine, surgery, orthopedics, gynae. You can put n number of departments. Then there is a stem and there are roots. Okay, so the roots consist of, they are very important, the fundamentals. They consist of anatomy, okay, physiology and biochemistry. Okay, anatomy, physiology, biochemistry, if they compose of the roots and the clinical subjects make of the leaves and branches, then the stem is made by pathology. And that is how pathology connects the root from the leaves. So it is the link between the non-clinical and the clinical subject. Now one more thing that I would like to say is, clinicians, they suspect, and it is the pathologist who confirms and gives the final diagnosis. Now suppose there is a lymphadenopathy, okay, any patient having a lymphadenopathy. Now clinician can only know that there is a lymphadenopathy. Clinician cannot know because it is because of tuberculosis, or because it is of metastasis, or it is because of lymphoma, or it is just a autoimmune disorder. Okay, so the clinician will suspect that there is a pathology, that is lymphadenopathy. Now if a FNAC is done or a biopsy is done, then the pathologist will confirm that the disease process is XYZ, and accordingly TB has to be treated, or metastasis will be treated, or lymphoma will be treated. So you can make out that every disease will have a specific type of therapy, and that is decided by the pathologist. So once the report goes as carcinoma, treatment is different. Once the report goes as lymphoma, the treatment is different. Okay? And that is why I believe in saying that pathology is the grammar of medicine. If your grammars are wrong, your English will be very poor. Similarly, if your pathological diagnosis is wrong, then pathological diagnosis is wrong, then the whole treatment process will go wrong. Okay? So if a patient is having a tuberculosis and wrongly reported as carcinoma or wrongly reported as lymphoma, then the therapy will be according to lymphoma or carcinoma, and tuberculosis therapy will not happen. But exactly the patient should have been given tubercular treatment or anti-tubercular treatment. And that is why I believe in saying that pathology is the grammar of medicine. So that is how important pathology is and what we need to know about any disease. Okay? So what we need to know when we study any disease, first we try to know the definition of the disease. When you will be reading the textbook of pathology, you will first find, in the first part of the disease, you will find the definition of the disease, and it is a state in which the individual means the person, exhibits either anatomical, it can be physiological, or it can be a biochemical. Now anatomical, suppose somebody has a osteoarthritis, is not able to move around, is not able to climb steps, so that is an anatomical problem. Or somebody has a tumor in the knee joint or close to the knee joint, that is an anatomical problem. Now what is a physiological problem? Somebody like our respiratory problem, okay? Somebody has a lung pathology, because of which the person is not able to respire in a normal way, that is called as physiological and biochemical. Suppose for instance a patient has diabetes mellitus, the blood sugars, okay, blood sugar is elevated, that is called as biochemical deviation from normal. Okay, so that is the definition of the disease. Then we need to know the epidemiology, that is when and where. So how the disease happens comes next, that is the etiology. So what are the causes of the disease? Next comes the pathogenesis. Now this is what I was talking about, how the disease happens, how the disease evolves. Now evolution means a disease can have an early stage, Okay, a disease can have a late stage, so this is called as evolution of disease. And during this evolution, many changes happen that can happen at molecular level, those changes can happen at biochemical level, as well as those changes can happen at morphological level. Okay, so you must remember that is, if you talk about epidemiology, it is when and where. When we talk about etiology, we have to mention about the causes. When we talk about pathogenesis, it is how and how the evolution of disease has happened. The next, morphologic changes, I have already told you. Then comes the clinical features, because the clinical features will depend on the morphological changes. Okay, for example, if a patient has osteoarthritis, okay, there is a osteoarthritis which is a age-related degenerative disorder. Now suppose there is osteoarthritis, in the early part patient will have minimal pain, okay, some pain and some disability, but as the disease progresses, the patient will not be able to get up from sitting, okay, or will have difficulty in climbing steps, and there will be severe degree of pain. See, this is early disease and this is late disease. How the disease has progressed and the clinical features will vary with the morphological change that happens. So in early disease, some cartilage is preserved, okay, so there is minimal pain, but in late disease almost all cartilage is degenerated, and that is why the patient will have severe clinical features. Okay, next comes the prognosis. I have already told you, prognosis means how the tumor will behave or how the inflammation will behave, what will be the treatment, what will be the outcome. Now suppose some patient has a lot, or let's say example, a patient A has a cervical carcinoma, okay, whereas a patient B has a pancreatic carcinoma. Now usually cervical carcinoma with the help of screening can be detected early, so the prognosis will be better, whereas pancreatic cancer has very poor prognosis and most patients will die within 6 to 12 months of diagnosis, because these tumors present very late. Okay, so that is how the prognosis is decided, depending on the stage of the tumor, depending on the grade, the stage, the grade. Okay, grade is about the morphology, whereas stage is about the clinical presentation, and the grade of the tumor as well as the stage of the tumor, both are important in deciding the prognosis of the patient. The last is management and prevention. The management means treatment, and certain times we can ask them, suppose there is a problem like osteoarthritis, some lifestyle modification can be advised. Okay, so some modifications has to be done, and that is called as prevention. So the early disease is there, it does not go to a late stage disease, and there we have to ask them for some interventions. So if you see, I have put these 4 in the bold because a pathologist will be dealing mostly with the etiology, the pathogenesis, the morphologic changes, as well as the clinical features of any disease process. After knowing about a disease process, we need to know why we are classifying these disorders. Now diseases can be classified into developmental, which comes from birth. Okay. Second is acquired, which are acquired during the lifetime. Now when we acquire these diseases can be inflammatory, like you can have autoimmune disorders, let's say SLE, you can have rheumatoid arthritis, these are autoimmune disorders. When we talk about infections, you can have tuberculosis, you can have syphilis, and these are all infections, and all these infections as well as autoimmune disorders are characterized under inflammatory pathology. Next comes nutritional. Now nutritional means what we consume day to day, and because of certain deficiencies we can have anemia like iron deficiency anemia, we can have megaloblastic anemia. So, and it is not necessary that nutritional is always deficiency, nutritional can also be excess. and when nutritional excess is there, we develop obesity. Now obesity is also a nutritional disorder, and PEM is protein energy malnutrition. Okay, so this is another pathology that comes under the nutritional category. The next we go on to why we need to classify disease. Now classification means we can categorize disease into developmental, into acquired, and in acquired it can be inflammatory, it can be neoplastic, etc., etc. So the first disease comes is developmental, and developmental means it is from birth. Okay, the second category is acquired, and this acquired is more common because almost all diseases that we study, almost you can say 95 to 99% diseases will be categorized under acquired diseases. The first of all is inflammatory. Inflammatory means it can be again infective, like say tuberculosis, whereas autoimmune disorder like rheumatoid arthritis. The next comes nutritional. Now nutritional, like say for example iron deficiency anemia, or you can say megaloblastic anemia. That is about nutrition. Even obesity is classified as a nutritional abnormality. The third comes neoplastic. Neoplastic means we talk about tumors, and tumors can again be categorized into benign, or tumors can again be categorized into malignant. Okay, and all this categorization is done by the pathologist. Then some diseases can be degenerative, like I have already mentioned, age-related disorders like osteoarthritis. Okay, as well as say CNS or a disease of forgetfulness, or the patient loses memory, that is Alzheimer's disease, is also a neurodegenerative process. This happens in the bone, this happens in the brain. Okay, the next comes metabolic disorders, which are again common. You can find diabetes mellitus, and maybe in next 3 to 5 years India will be the world's diabetes capital. So you can imagine how many patients or how many people in India are suffering from this common metabolic disorder, that is diabetes mellitus. The last comes iatrogenic, which is therapy induced. Now whenever a person undergoes some kind of treatment, there will always be some side effect. Like say for example, a patient is given chemotherapy for some malignancy. This chemotherapy will take care of the tumor, but this chemotherapy will also cause bone marrow suppression. Okay, and this bone marrow suppression will lead to pancytopenia, or WBC, RBC, all series will be reduced. This pancytopenia can lead to infections, or this pancytopenia will lead to opportunistic infections. So now you see, the patient may not die of the tumor, but the patient may die of the infection. So every treatment that is given can have some amount of side effect, and that is called as iatrogenic pathology. Now you must be wondering why we need to classify, because each of these diseases will have a specific therapy. You cannot give a therapy of diabetes to a patient who is suffering from Cushing syndrome, neither you can give a diseased person who is suffering from obesity can be treated in the same manner as a person suffering from anemia, and that is the difference, and we need to classify diseases. Then we move on to the books to follow. Now this is a very important aspect that you may ask me, sir, which are the books to be followed for pathology? I would say you read any textbook of your choice. Okay, but options are limited. One is you can read the Robbins Pathologic Basis of Disease, or you can read the Hirschman textbook. Okay, so I would say you can buy both textbooks if you can cover, but if you want to go for an Indian author, Hirschman is a very good textbook, and in addition to that you will also have a MCQ small booklet which will be helpful in covering up your MCQ portions. Okay, the second is question answer book for revision of MBBS exam. Now when we read pathology, we read for the MBBS exam first and then we read it for the future entrance or for our practice. So our first target is to do well in the MBBS exam, and for that you need also a question answer book along with a textbook. Okay, so textbook you can follow Hursman, whereas if you need a practical pathology book, then you can refer to Practical Pathology, and that is also by Hursman, and that is also a very good book which gives you a elaborate gross specimens as well as different laboratory methods. So your theory portion is taken care of. You can also read another book which is for exam preparation, and that is by Ramdas Naik. Okay, so here is Ramdas Naik, and this book is good for your question answer because this gives a very nice aspects of short notes, long questions as well as some MCQs. So you can use this book to cover up all these aspects. Okay, the next comes the objective book. Now one MCQ book you can read now or you can do it later, and this MCQ book will test your understanding, because MCQs deal with very intricate aspects, and so once you read the chapter you need to do some MCQs so that the intricacies or the fundamental understandings of the concept get fixed, and that will also help you for your NET preparation. Okay, so that was about the books to follow. After we know what books to read, now we need to know how we read. Or this is another important thing on how to approach the subject, because some people are fast learners, some people are slow learners, and some people may be good in understanding little bit of a moderate level of reading. Okay, so how to read? First is read every day. Now suppose for example you have pathology classes for 3 days a week. Okay, 3 days. So at least make sure after the class you go and read the portion. Okay, so 3 days a week you can at least give time to the subject, and what good thing is that after the class if you read the chapter, then there will be a better understanding and you can clarify your doubts in the subsequent class. Then read a standard textbook. So you can read any standard textbook, either Robbins or Hursman, but you must read a standard textbook first before going to question answer books. Don't start with a question answer book because your concepts will not be cleared by them. Concept clearance is good with a proper textbook. Then second thing, try to understand the concepts. That is very important. Some people, what they do, they mug up. Okay, they will just try to learn repeatedly, they will learn and they will remember the definition or they will remember the etiology, but they don't try to understand the concept. Once you understand the concept, it is very easy to answer even the objective questions as well as to understand correlations with pharmacology as well as microbiology. For example, when we read about bronchial asthma, we read about the pathology, and each step of pathology we need to know in order to understand which therapy will be effective in which type of pathological condition. So that is about understanding the concepts. Next, you can make notes for yourself. Some people prefer reading books, some people prefer reading notes, and if you are comfortable with notes, then when you are reading the chapter, you can make a note, you can have a separate note, or what you can do, you can put some sticky notes into your book. Okay, now suppose you are reading 2 textbooks and you want to merge them into one, then you can take notes of one book and paste it into the other, or the important points of one book and paste it into the other, so that what happens during the exam, you don't have to read 2 books, you can complete your reading from one book, or you can read your notes for your comfort. The last is attempt solving some MCQs. This is very important, and this concept was not there when we used to be students. We just used to read textbooks. Okay, so reading textbooks, you will understand certain concepts, but to test out how well you have understood, you need to do some MCQs, and that MCQs will test your understanding as well as prepare you for your NET exam. Okay, that is why your understanding or preparing for MCQs is important. The last is previous year's question paper. Now this is very important because each of your institutions or universities will have different patterns of exam. Okay, so some may ask for long question, some may ask for short notes, the other may go for MCQ type questions. So different institutions, different requirements. So you must see what is the previous year's question paper, what is the pattern. Okay, the other thing that you will get idea is which are the important chapters, which have commonly questions have been asked from those chapters. The other thing is, even in each chapter, again you will know which are the most important portions. Okay, and this you will understand in my next slide. So pattern, which are the important chapters, and in each chapter which is the most important portion. Okay, when we move on to learners, then learners, they need to know what is priority pyramid, or this priority pyramid is very important aspect of our learning. We just can't be going or reading this, X, Y, Z, A to Z. We can't be reading everything and we cannot remember everything. So first we must know what is the must know area, and this is important because from must know areas you will get around 60% of your questions from must know, and that is every student should know. Okay, that is must know. Then there is something called should know, and this you will get around 20 to 30% of the questions. This is for the good or mediocre students. Okay, and there is something called as nice to know, and this is for the very good students. Okay, so you will get only 10% of your questions from nice to know areas. So if you see each chapter, then each chapter will have some must know area, will have some should know area, and there will be some nice to know area. And how will you know them? You can know them from your previous question papers, and that is why I stressed that question papers are very important aspect of your preparation. Okay, and you must assess your capabilities. Now some students are very good. Okay, so for very good students you need to know the full chapter. Okay, the full chapter has to be covered thoroughly. Some students will be average, so what they can do, they can just know the good to know as well as the must know. These two areas can be covered, and for the poor learners I would say minimum is must know areas, which is around 60%. So if you know the must know areas properly, at least that will make you pass the exam. Okay, so this is in a diagrammatic representation. If you see here, the core area is must know, and a little bit more if you want to know, that is should know, and this purple area is nice to know. So if you are a poor student or you are a late beginner, you should always, or any student should first cover the must know area. You should not cover the nice area instead of covering the must know area, because this will get you 60% of questions. Okay, so I would stress every student should cover up the must know area first. Now the other thing of reading is Bloom's taxonomy. Now you may not be aware of it, or you can browse it in the internet to know a little bit about Bloom's taxonomy, but Bloom's taxonomy is about learning. So when we read a chapter, we remember certain things, then we understand certain things, and we apply certain things. Okay, so this remembering, understanding and applying are actually lower order thinking. Okay, these are lower order learning, whereas analyzing as well as evaluating, these are called as higher order learning. Okay, so this lower order learning, if you are interested in this, then you will not be doing well, because nowadays the questions are application based. Okay, they will not be direct MCQ, they will be an indirect MCQ, and if your fundamental is poor or your concept is poor, these application based questions you will not be able to answer, or you will not be able to apply your concepts properly in your day-to-day life. So your target should be analyzing as well as evaluating, instead of just mugging up some of the questions or some of the short notes. Now how to prepare for your exam? Okay, so when we read a subject, our first target should be to clear the MBBS, and after we have cleared the MBBS, our next target is our common entrance. And to pass the MBBS, you need to know theory as well as you need to score some marks in the practical. And for NEET, you can always have to focus for multiple choice questions. Now for preparation of theory I told you will vary according to university, according to institution, and these theory questions can be case based. If you go through our sessions, every session is set up with a case. First case scenario and then we go on to the chapter. Okay, so it can be a long question which is of 10 marks, or it can be 4 plus 4 plus 2. Like say for example, what is cirrhosis? That is 2 marks, the definition. What is the etiology of cirrhosis? Okay, so that is again 4 marks, and then what is the outcome or what is the complication, that can again be 4 marks. So that is case based long question. You can have short notes, you can have very brief notes, and most important is you have to refer to the question papers of your university or college in the previous years to have idea how to prepare for the theory. Next comes practical. In practical, you need to know certain gross specimens. These gross specimens again will be different in different colleges or different institutions, but in our session we have tried to cover maximum number of gross specimen. Okay, maximum number of gross specimen, so that you have a better idea on how the pathology affects different organ and what is the morphology of different organ in different pathology. Then about some instruments like some needles, some vacuum-tenors, those are instruments. Then you may be given some charts to interpret, like one CBC chart may be given to you. Okay, complete hemogram chart, and from that you have to find out whether it is first anemia is there. If anemia is there, then it is microcytic hypochromic anemia or it is macrocytic anemia. If it is microcytic hypochromic anemia, whether this is iron deficiency anemia or this is thalassemia. Okay, so that is how from the chart you have to read certain interpretation or tables, and from that you have to get some inference. This was about your theory and practical, and for MCQ you have to read and understand the concepts first. The most important is for direct questions you don't have a problem, like I will say what is the most common nerve supplying this, or what is the most common abnormality associated with this nerve. That is a direct question, whereas a indirect question is when a case scenario is given. Okay, when a case scenario is given and you have to read all the history and that arrive at a diagnosis, and their questions will be relating to this diagnosis. That is what is called as indirect or case based, and this is all higher order thinking questions. Okay, and for reading you can always use any MCQ book for your reference. Okay, after the preparation of the exam I will tell you why we need this DigiNerve, or why DigiNerve is helpful or how it is helpful. In DigiNerve, we have tried to incorporate numerous clinical, pathological, microscopic images along with tables and charts. If you go through this session, you will realize that this number of images what has been incorporated into is huge, and it has been compiled from different textbooks and not just from one textbook. Okay, now every session will, whenever a session is being covered, the questions will be highlighted as well as the short notes. Now some questions can be long question, some can be short note, and some can be MCQ. And in each session you will find a speaker highlighting which are the important portions to be remembered for long question, short note as well as MCQs. The next is the practical aspects is also covered, and detailed discussion on approach to different diseases. Okay, so how to approach different diseases, and that is on case scenario basis. Okay, on case scenario basis we have discussed how to approach disease as well as the practical aspects, in which we have tried to show you some specimen and the questions relating to that specimen. Okay, so we will show you numerous specimens relating to different pathology, and we will be telling you what are the questions that can be asked in relation to that specimen. Okay, next is case based approach to each disease, and that will enhance higher order thinking as well as application, which I have already highlighted. Next, we move on to pathology as a subspecialty. Some of you may be interested to take up pathology as a specialty, and I would say that pathology is a very interesting subject. Interesting in the sense, already I have told you that it is the mother of all subjects, because everything that you read in any subject, any chapter, you will be covering a portion called as pathogenesis, and that is why I find pathology very interesting, and pathologists are the people who make the final diagnosis. The clinicians only suspect, whereas it is the pathologist who makes the final diagnosis. But the most important thing is here that interest and enjoying the subject. You see, if you are interested in the subject and you are loving what you are doing, definitely you will do well in the subject. But if you are doing it out of force or out of compulsion, then you will never be able to excel in the subject. When I used to be an undergraduate student, I used to take pathology just as a subject. I never thought that one day I will become a pathologist, but today that I am a pathologist, I am very proud and happy that I am a pathologist because I make the final diagnosis. But the most important thing, that is interest and enjoy. Today I love and enjoy, and I am passionate about my subject. Okay? The other important point about pathology is that it is really evolving, and if you remember, I have told you there are some 8 to 9 subspecialties to choose from. Some 30 years back you can say pathology was just one subject, that is pathology, and one person used to do all the subspecialties. Okay? Today it is about specialization in each of the subspecialties, and today we have neuropathologist, okay, who look after brain and nerves. We have gastrointestinal pathologist, we have hepatobiliary, we have nephropathologist who look after kidney, you have the cytopathologist who do only cytology, then you have hematopathologist who do only hemat. So if you are interested in any of these subspecialties, you can always think of taking pathology as a subject. And before I conclude, I would like to give my acknowledgement, or I would like to thank Dr. Hirschman, who is not only a big pathologist but is also my teacher, who has taught me the basics, and numerous pictures that I have included in this discussion or sessions are coming from his textbook. Okay? In addition to that, I am also thankful to Dr. Ramdas Naik, whose book I have used for image purpose, as well as I have taken certain questions which will help you to understand the subject better. The last is Dr. Ivan Damjanov, from which numerous histopathological or microscopic pictures have been included for your better understanding. Okay, so with that I would like to conclude and convey my best wishes as well as happy learning with DigiNerve. Thank you so much.